Jai Jagannath. Today we are going to see the coma in impaired conscious level. We have studied about coma in detail earlier. Today it will be all about the diagnostic approach. So before getting into the diagnostic approach, I would like to talk about consciousness. Obviously today the consciousness will be only medically I would like to talk about. I'm not going to the spiritual one. So consciousness, how do you define consciousness? How do you define? It's a it's basically state of awareness, isn't it? Consciousness we say, right? So state of awareness. Okay, sure. Sorry. State of awareness, right? About so state of awareness of what? Of self and surroundings, right? So this is the all about consciousness. I mean, you medically we this much only will take, right? Now let us talk about something about coma. So what was coma? Anybody can detail a little bit? Yes, yes, correct. So coma is like, if you remember, we had three components here. So first one was speech, second one was eye opening, right? And third one was anyone? Yes, wonderful. Look like you have revised really well. Motor response, wonderful. So all these three components, if we talk about coma, so what do you think as per Glasgow coma scale? As per Glasgow coma scale, it will be 0 0 0, right? This is how the coma we define. Okay, cool. So this was one thing. Okay, so Glasgow coma scale, I hope it was wonderful, like this, like we studied in a very quite wonderful way. So like if it is like different terms are there, like stupor, semi coma, deep coma. You would have heard somebody is in coma for about more than 10 years, 15 years, like that. So deep coma. So different kind of observers, they have different kind of terminology. Okay, semi coma, deep coma, stupor. Okay, now coming to the pathophysiology. Yes, pathophysiology. So we will define pathophysiology in a very uh, easy way, so that you can remember. Again, diagrammatic, as you all know. So this is how you can take it as a brain schematic diagram. So central, like cerebral hemisphere, basically cerebral hemisphere, the brain is tight organ, so cerebral hemisphere is totally intact, right? So any kind of any kind of disturbance of, so we will use the word diffuse. Okay, diffusely, sorry, we will word the adverb, we'll use adverb diffusely. So any kind of disturbance which is diffusely affecting, is quite diffuse in nature, and as I said you, cerebral, I'm talking about cerebral, mind my terminology, cerebral hemisphere, right? So normally it is intact, right? If you talk like this, so I'm making it red so that you have a contrast. So suppose this is the state of awareness, like this is how it is, cerebral cortex is totally intact. So either cerebral hemisphere, okay, or reticular activating system. Both, either of that. If it is into impairment, if it is into trouble, it will collectively or individually give to the impairment of conscious level. Okay, so medically we will see like this. Good. Good. Yeah, anyone? Okay, cool, no problem. So this is the basic thing. Okay, so what I'm saying you, it's like a diffuse, diffusely it get damage, any kind of issue to the intact cerebral hemisphere. I'm writing in bracket, so it is intact in feature. Okay, fine. Let us go to the like pathophysiology in detail. I'll just a minute, I'll make it like this. So in detail. Okay, so pathophysiology in detail. So I'm again drawing the image. So my all teaching goes with the more of image, so it will be easy for you guys to understand. That's the reason I'm using the red color. Okay, schematic diagram. Just one sec. Okay, let us make it a black diagram so that it will be easy for you to understand the color feature later. I'll use black, don't worry. It's all right. This is your strand, and this is how it comes out. Okay, it comes down. It comes down, so I'll take it like this. Okay, coming down. Okay, so yeah, so this is, what is this organ? Anybody can tell me this particular part? Just message me, that's enough. yeah, that's enough. If you message me properly, I'll be thinking you are interested, right? Okay, good. Now I'm just shading it with the red color. So basically hemisphere, cerebral hemisphere, cerebral cortex, basically, not hemisphere, cortex I'm talking about. Okay, and so and this part I'll have a different color so that you can understand better. A little different color. Okay, just for your understanding. Yeah, and now I'll be using red color for different kind of organ like this. Okay, I'll come on that, don't worry. This particular I made it a little more curved anyway. Now it is okay, better, I mean to say. Yeah, cool. So either there is a damage to cerebral hemisphere, hemisphere, right? Cerebral hemisphere damage. Okay, and I'll write it diffuse cerebral hemisphere damage, this area. Okay, now this particular part, front part is what? Yes, but we'll be writing it focal damage. Okay, frontal focal damage. Yes, and yes, I'll come on that, don't worry. Here in down, what it is about? Oh, area wise you tell me. Brainstem involvement, right? Brainstem involvement, or brainstem compression as well, this particular part. Okay, anybody can tell me what it is? Just tell me the name of the organ, I'll be very happy. Supratentorial mass. You know how much I have worked on your anatomy, right? Yeah. Anybody? I asked you earlier also. Tell me this particular mass, which region it is? Yes, good. You can just message me, that's enough. Yeah, I mean you can just comment it, I'll see that. Yeah, so thalamic involvement, nice. Now yes, obviously it is bilateral. Okay, so we'll see reason one by one. What it could be? Thalamic involvement, astrocytoma kind of thing, right? Diffuse cerebral diffuse hemisphere damage. What it could be? Tell me. Yes, very good. Road traffic accident, that is, we'll take it as a trauma. Anything else? Ischemia. Yes, you're right. Yes, I'll write it hypoglycemia. Right, and again the metabolic system, like liver or renal, hepatic or renal failure as well. Right, we'll come on that metabolic region one by one. Okay, focal damage. You know what? Usually doesn't affect conscious level. Yes, it doesn't affect usually. Brainstem involvement, again it could be ischemic, isn't it? Ischemic, and it could be hemorrhage, right? It could be tumor. Anything else? I'll write it drugs. Can anyone tell me any kind of drugs? Okay, antipsychotic, but others, like, can you be a little more specific? Sedatives. It could be even the hypnotics. Nice. So this was the, like a pathophysiology in details where it can cause the issue. Cool. Well, now let us talk about certain causes. Obviously. So these things happen because of certain involvement, right? Where the coma can result. So causes we will see again technically, I'll come on causes. Just 1 minute. Yeah, causes. Uh, you know what? Causes. Just 1 minute. Causes we will divide in broadly in two parts. It's better for your understanding. Is better for your remembrance. First will be intracranial and second will be extracranial, of course. It's better for your remembrance. So this is how I have studied, this is how you should study. We should be very clear about our concept. Cool. So now, intracranial region, it could be trauma. Well, it could be vascular region. I'll come on that, don't worry. I'm just listing it first. Epilepsy, hydrocephalus, neoplastic region, it could be infective meningitis, it could be encephalitis, it could be brain abscess, brain abscess. Okay. Extracranial region, yes, let us make it a broad term like a metabolic region. Okay. Endocrine, obviously, yeah, interrelated. Anything which can reduce blood flow, I mean to say cerebral blood flow. Hope you remember we were talking about the autonomic supply of the brain, right? Anything which can decrease cardiac output, right? Okay. Well, anything like a drugs, very good, few kinds of drugs. It could be even toxins. Okay. And list at last but not least is a psychiatric disorders. Okay. So these are the major regions. If we see, like, we try to understand like how these regions work, like trauma. Okay. Diffuse white matter injury. Okay. Diffuse, you can say diffuse white matter injury. Okay. It could be subdural hematoma, extradural, or SDH, subdural hematoma, right? Anything, this kind of trauma. Vascular region again, anyone? Subarachnoid hemorrhage, or any kind of infarct region, like let us cerebral infarct. Well, especially cerebral infarct with edema. Sorry. will result. And of course, epilepsy, hydrocephalus, neoplastic, meningitis kind of condition, or encephalitis kind of condition, or pyamic conditions like brain abscess. Well, extracranial, if we see metabolic. If I say metabolic, it's a big one, right? So a lot of minerals disturbance, hypo or hyper, right? So either sodium issue or potassium issue or calcium ion issue also, right? Or uremia, right? Or even the, okay, well, for now you understand this much: either hypo, natremia, calamia, calcemia, uremia, all these things, right? Okay, endocrine reason, that means basically we think about diabetes. Yes, it can cause hypopituitarism, first year, right? First year, you remember. Hyperthyroidism, why not? It can cause, it could be one of the reason. Anything this kind of metabolic. Okay, anything which can reduce cerebral blood flow. Can you name few of the things? Okay, uh, very simple: blood loss in any kind of RTA. Cool. Or there is something called vasovagal attack. Those who have attended my classes on vascular disorders, they know that I explained that quite nicely. Decreased cardiac output, what it can give rise to? Either myocardial infarction, or it can give to, tell me, basically cerebral. Yes, correct. So what happened basically, if it is a decreased cardiac output is causing these two, it will ultimately reduce the cerebral blood flow. It can cause the, yes, it can cause the coma. Yes. Drugs, yes, sedatives, hypnotics, etc. Okay. Toxins, alcohol abusive cases, or carbon monoxide poisoning, CO poisoning, very common. And anything else you can tell me? Toxins may heavy metals. Okay. Psychiatric disorders, can you name few of that which can cause that? Hysteria, for your remembrance. Catatonia, this is your task. Let me know what is catatonia next class. And this is also your task, pure state. I'll wait for you. Okay, so once you tell me in the next class, we'll have some discussion on that. Okay, so this was the major, like a broadly we see as a causes which can cause the impairment of conscious level. Dear friends, dear students, these things, when we understand in a broad way, it gives us a very good clarity that which can cause coma, of course, and it can give us the clue how we can go for the diagnostic approach, right? So what I'll do, I will go, just 1 minute, I'll go one by one so that you can understand. Just 1 minute, I think, yeah. So diagnostic approach, what is the best thing we are going to do in the diagnostic approach? First thing, like how do we start with? History. Yes, few of you recently joined my class at my place. So it was about, like history taking, and it detailed, like I detailed personally, like how good history taking helps you in any sort of diagnosis. Okay, head injury. Okay, you'll have to find out whether there was any kind of head injury, okay, recent, or any kind of previous head injury. Okay, or you have to find any kind of sudden collapse. Okay, you have to find out history of incontinence, very important, or any sort of associated limb twitch. Good. You have to find out any kind of symptoms which has gradually developed. So gradual development of symptoms. Okay, obviously past history we have to check. So previous history of illness. Yes, any question you have? Yes, obviously you are 100% right. So we will take the, yes, of course we'll take those history, but Rohit, like it's always good that when we go one by one. So what could be the possible couch? I'll use another color so that head injury, obviously intracranial hematoma could be the reason. I'll write it here. Wait, possible causes which can create. Okay, so head injury, it has happened. So what it could be? It could be intracranial hemorrhage. Intracranial hematoma. Let us start like this, hematoma. Okay, or any sort of diffuse searing injury. When we will study the head injury chapter in detail, we will talk about DAI. Okay, diffuse axonal injury. That time it will be, these things will work for you. So we have to study these things in detail, but one by one. Diffuse searing injury. Okay, this could be the possible cause. If it is a previous head injury, I'm talking about, let us take 6 weeks. 6 weeks before there was a head injury. Then what could be the possible cause? Yes, subdural hematoma. SDH. Very important 5 marks question. Especially cerebral hematoma of subdural hematoma of chronic origin. It will turn chronic, right? Then only. Okay, sudden collapse. This history has to be taken from whom? From relative, friends, and anyone who brings the patient to the emergency. Who brings to emergency, right? You can actually ask from them only. Okay, you have to have question about the sudden collapse. If there is a history of sudden collapse, then what it could be possible reason? Hemorrhage. Yes, so let us put it a little more specific. Intracerebral hemorrhage. Okay, or any kind of hemorrhage you can list it. It is a subarachnoid hemorrhage. Okay, incontinence and limb twitching, where you can see, you can find in seizures. So epilepsy, right? Or any kind of postical state, right? So these things, basically epilepsy, remember. Postical state, I hope now spelling is correct. Yeah. Now, next, gradual development of symptoms. Patient will people will tell, like earlier he was okay, he was able to tell his name, he was able to pronounce things, he was moving his limbs, and initially he actually kept his eye also open. But suddenly what happened? He started forgetting his name. He's not talking. He's not moving his hands. Till we brought to the ward, till we brought to the emergency, this is the situation. So it's a gradual development of symptoms. Or they can tell you, like 5 days before it was good, he was able to open the eyes, he was able to tell his name. Later he was not able to tell his name, he was not able to open the eyes as well, not even giving any action. That means what? Anything like happening gradually. Now there is, don't ask me the question of like how gradual, we cannot put the gradual on a particular time bar. Okay, time scale is not for the gradual. Like, yeah, gradual, that means slowly the symptoms have developed, and due course this has turned into kind of coma situation. What could be the possible reason? Yes, growth. Yes, so we will write it as a mass lesion. Okay, anything else? Yes, very good. Metabolic. Yes, metabolic regions. Or it could be again meningitis kind of thing. So we will list it as a broadly like infective causes. Okay, this can happen slowly. Okay, if it is a previous illness, it will give you idea. Like they'll tell, like it was a very severe diabetes since these many years, he was on medication and regular insulin. Okay, so it could be diabetes. So it could be both. It could be both hypo and hyperglycemia. That could be the situation. Yeah. Okay, either psychiatric, the person was like having a psychiatric disorder, or any kind of history you can take. Obviously infective history, infection was there since so and so, and then it was not getting control with antibiotics. Even they ran very strong antibiotics, but it wasn't getting control, and later it went into the in the severe form. Anything else? Yes, yes, all three of you are correct. We'll put it as a malignancy. Okay, basically what? um, Basically metastasis. Yes, metastasis and intracranial. Basically intracranial, we'll take it as a reason, cause. Metastasis, which is intracranial. Okay, so this is what history is. Like history we will be taking like this. Well, yes. Yeah, definitely. If we find limb twitching, epilepsy could be the reason. Yes, obviously, yeah. Incontinence. Well, incontinence in lot of condition it can be, but again, incontinence we have to find out history about the incontinence, because many a time, even if it is a psychiatric disorder, many a times patient don't feel like going to toilet, and they don't without saying anyone they pass. So even though they feel, they may not have control, right? So let us not get into the detail of that, because when the chapter will come we will get into the detail of that. For now you have to remember these many history you have to take, and you don't have to forget anything out of this. Okay, let us go for another approach. Like after history, what usually we do? Yes, right. General. Let us make it examination, like a general examination. Okay, then we will go for specific one. So general examination, what are we going to see in the general examination? You have to have a note. What are you going to note? the presence of, just 1 minute, 1 minute, 1 minute, 1 minute, 1 minute, 1 minute. I'll make it next time I'll make it a little thin so that you know it is easy for you. Laceration, you have to see the any kind of presence of laceration or bruising or the instance of CSF leakage. Okay, then you have to check the internal auditory meatus, auditory meatus. Okay, next you have to check the presence of whether it has head has been enlarged or what. So enlargement of head, okay, especially in infants, right? Especially in infants we have to check. Yeah, like what is the reason that's how we have to find out the general history, right? And this is very important. What I'm writing, just keep in the mind. Neck stiffness, or any kind of retraction if you see, right? And then there is something called Kernig sign, you remember? Yeah, so I will not ask you unmuting you. Okay, reason behind that, I have to ask you these things when we will have a practical class. Okay, now tongue biting, you have to yes, exactly, that's the reason. Disease specific we have to go later. First we have to see the general presence. Tongue biting, okay, tongue biting is very important, especially these cases. Okay, then we have to find out metabolically any case of hepato. Just 1 minute, 1 minute, 1 minute, 1 minute, 1 minute. I think there is some issue, so it's not taking it. Don't worry, I will take it next time little less. So hepato, case of hepatomegaly, okay, or any kind of lymph adenopathy you have to find out. Lymph adenopathy, lymph adenopathy. Okay, lymph adenopathy, yes. Lymph adenopathy. Okay, there was a question on that. Okay, I'll come on that. Then you have to find out the source of infection. Source of infection. Yes, of course, source of infection has to be found, right? Which kind of infection has come on? Then obviously the vitals we have to check, and in that is very important is fever. Why fever? Because this is one of the symptom of again infection. That's the reason. Okay, so where laceration, where we can where you can see laceration, anyone? Or bruising or CSF leakage, head injury, right? So I'm giving you a glimpse what your general history can tell you about. So it's a head injury, right? Internal auditory meatus, you have to check if there is any kind of bleeding. That means it's because of again, yes, trauma, right? You are correct, trauma, that means head injury, right? Yes. Or I'm giving you one this one, if it is a pus, then what will you find? Infection, very nice. So it could be meningitis, or it could be cerebral abscess, right? Yes, this is how we have to find out. Enlargement of head, where it can be? In the case of if intracranial pressure is high, right? Okay. Neck stiffness, where the sign will come? Neck stiffness I'm talking about. Neck stiffness, where it will come? Or kind of retraction. Give one example. Okay, any kind of tonsillar. I took this chapter in very detail. Tonsillar herniation. They'll upload on that. Don't worry, you can revise it. Those who are not present, you can revise it. Okay, Kernick sign. If you see Kernick sign, what it could be? Just 1 minute, 1 minute. Yes, you're right. Yes. Yes. You're totally right. Kernick sign you will see in meningitis. Yes. Tongue biting, seizures cases. So epilepsy could be one of the reason. Okay. If it is a hepatomegaly or lymphadenopathy, right? So what could be the reason? Yes. Any sort of metabolic condition, right? Yes. Even the even it could be even the intracranial metastasis, right? Then source of infection you have to find. Suppose source of infection is ear or lung or sinus, right? So depending upon the infection, you can find out how severe it is, right? Obviously, it could be meningitis, it could be cerebral abscess. 2 minutes break. I'll be back. Yes. Oh, yes, I'm back. So fever, pyrexia. Okay. Pyrexia, it could be because of, I understand. Okay, here it could be another infection like meningitis, or it could be abscess. Okay, pyrexia. It could be even in the condition of infection, right? Or it could be even in case of subarachnoid hemorrhage, right? Or any condition, you tell me. Any kind of hemorrhage which is intracerebral positively can also cause fever. But basically fever gives you idea of infection. Okay, so this was our general examination. After that, what I have taught you, apart from this general examination, what else we have to go for? Anyone? Systemic. Very nice. So I'm just listing you out. Yes. So other systems, what are you going to see? Cardiac. So let us see like what are you going to check? Cardiac arrhythmia. any kind of irregularity in cardiac. And obviously you have to check blood loss. What is again the source? Because blood loss usually cause what? Low BP, and in turn it can cause the problem. So more and more loss is a problem. Okay, any kind of valvular disorders you have to find out. Okay, this is also very, very important. Valvular disorders. Okay, then you have to go for respiratory system, very, very important. So basically we'll note it down like a respiratory insufficiency. Yes. Okay, apart from that, any other things we have to find out? Tell me, important. You have to see smell of alcohol. I thought you are having eyes on like when we were talking about causes. So you'll be able to see needle marks. Basically needle marks on the limbs, needle marks on limbs. Okay, anything else? Last thing we will see as a snout rash. I listed these three separately because these three are also the region, and these three are little different from our normal metabolic and intracranial regions. Cardiac arrhythmia. Cardiac arrhythmia, blood loss, or like these two, either this or all together, it can give to what? It can give to cardiac output reduced. Cool. Then valvular disorders, what it can cause? Emboli. And what will emboli cause? Reduced cardiac output. Correct. Now you understood the system. Respiratory insufficiency, what basically it will be? Anoxia. What anoxia will cause? Yeah, that's what I wanted to hear from you. Ischemia. And even the cardiac output, if it is less, it will cause ischemia. So see how it is interrelated, right? But I have listed in a different way, different head, so it will be easy for you. Okay, fine. Smell of alcohol, that means you could actually say that you can ask the question whether he is alcohol abusive, alcohol abuse case is there, or needle marks on limbs, that means drug addicts, there is a possibility. Snout rash, that means solvent abuse. Obviously you're right. There are people who don't understand the family, who don't understand the society, and they do every possible things like this. Anyway, that is not our discussion. So let us come back to the topic. Okay. So this was our general examination. Hope you understood properly. Okay, revise it. Don't worry, revise it. Yes. After that, we will go for our next diagnostic approach, which is, tell me, a specific one. So what is that? A specific one, since we are studying neurology, so it will be neurological examination. And I think now you guys are good enough to do neurological examination. Okay, so what are you going to see? Sign of raised intracranial pressure. Okay, like you have to check papilledema. I was a bit careful in writing spellings, you should be equally. You have to check however it is basically for infants. Tense, anterior, frontale, especially in infants. Okay, then you have to check what? You have to check pupil. So unilateral, again mind you students, you have had a very detailed classes about it earlier when we were doing our cranial nerve. Those things will be uploaded again, you can revise it. Unilateral, dilated, fixed pupil. Okay, you have to check, if we have checked unilateral, then we will be checking the bilateral, dilated, fixed pupil, as the name is indicating. I hope you are understanding. After that we will be checking whether there is a pin point pupil, as the name is indicating. I hope you understand. Pinpoint pupil, very important, pinpoint pupil. Then you have to check absence of eye movement. If it is there, it will have a different implication. Okay, so absence of eye movement. So again, it can be either, you know, fixed pupillary, or it can be reacting pupillary. Reacting pupil. So we'll check both. Okay, after that we will check about limb response. If it is either it is asymmetric limb response, or we will be checking the symmetric limb response. So basically when we check about limb response, we have to check the symmetry, which is the first thing to do. If it is asymmetric, if it is symmetric. Okay, then we have to check the, obviously again, full eye movement. Okay, then sub hyoid or vitreous humor. Vitreous humor, vitreous hemorrhage. I forgot to write that humor I told. Aqueous humor and vitreous humor. So I just wrote down that. So we have to find out the hemorrhage of vitreous origin. So vitreous hemorrhage, these things we have to find out. Okay, these things we have to check, but I didn't like till now I have not told you like for what, you know. Now we understood. Okay, fine, we have to check, we understood, but for what? So let us again see the possible causes, right? What it could be the main, you know, like how like what it could be, that's what I mean. So if these things are there, and along with this it could be intracranial mass lesion, then it will cause all these things, right? Intracranial. Bilateral dilated fixed pupil, what it gives you the idea? Tell me any one condition what you can think of. Enlargement of head. Okay, fine. So we will write it as hydrocephalus. This is one condition when it comes. Anything else? Diffuse cerebral swelling. So basically anoxia which cause, okay, and diffuse cerebral swelling it indicates in our examination. Okay, then any kind of anticholinergic drug overdose. Okay, well, if it is a pinpoint pupil, which part it will damage? Pons. Okay, so it is a possibly the cause of because of pontine hemorrhage. Okay, it is indicating that, or it could be even the opiate drugs. Okay, now as we checked eye movement, if it is fixed pupil, what do you think? Yes, nice. Trauma. Okay, but you know what, it could be even obviously just 1 minute, sorry, I'll write it right. It could be trauma, severe trauma in fact, and it could be even because of drugs also. People won't be moving, but if pupil is reacting, then tell me, if it is reacting, then think it. Metabolic, simple. Because brain is functioning properly, it is because of metabolic reason. Okay, body side reason. Okay, fine. New word. Well, hypoxic or hepatic involvement could be the reason. Okay, so we'll be writing hypoxic or hepatic encephalopathy. Okay, now come to the limb response. If it is asymmetrical limb response, what it could be? Any particular damage is there in the brain. So focal brain damage. Okay, focal brain damage. But what could be the reason? Anybody can tell me? Yes. Okay, I'll be writing tumor. Trauma was anyway the reason. And hematoma, well, and encephalitis. Just to make you understand, I wrote all these things, so sorry if you are having, you can enlarge your screen and see. Okay, fine. Now symmetric limb response. Yes, wonderful. Again, the problem from the metabolic origin. So it's a basically the, okay, let us combine it. Full eye movement and symmetric limb response. So this is basically what? It's a metabolic encephalopathy. Okay, okay, subhypoid or vitreous hemorrhage. What it indicates? Basically, subarachnoid hemorrhage. Well, now let us, when we saw about it, okay, so we saw the neurological examination. So these many things must be examined when your patient is in the ward, right? So this is how. After that, let us go to the infection. Okay. Sorry, investigation. Investigations. We will be listing investigations, like how to do it. In case of trauma, in case of higher intracranial pressure, in case of focal neurological signs, okay, these are the cases, or even case of meningism. Okay, these many cases we don't have to wait, we have to have CT scan. I'll be writing just 1 minute. We'll be having CT scan urgent. Urgently we have to do it. Fine. If it is negative, suppose findings are negative, you don't find anything of that, then you have to go for lumbar puncture to examine CSF. Okay, CSF examination is important, very very important, and you all have studied when I was taking classes on CSF. I was taking classes on intracranial pressure as well. Okay, fine. Now you are confirmed there is a condition metabolically which is affecting badly, so in that case metabolic diseases, I mean to say diabetes or hepatic encephalopathy, or in case of renal failure which is giving this kind of trouble, or even in case of drug abuse. Okay, drug abuse, these things, you know, we have to have more of what kind of test? Well, there was a question. Okay, well, there was a question. Sure, I'll answer. See, MRI usually we don't take in these cases, but when there is a, you know, like a neurologically we have to find, focal damage we have to see, then maybe MRI is of use, but usually it is a CT scan which is most important, and that's the reason I have written urgent. Okay. Yes, CT is the most urgent. Yes, they will ask you the question even in the viva also. Okay, fine. Metabolic diseases or any kind of drug abuse, what are we going to do? Regular metabolic screen. So metabolic screen will include a lot of blood tests, especially about the just 1 minute, I'll change the color so that it will be contrasting. Okay, fine. So usually it will be electrolytes, it will be blood glucose, okay, it will be different kind of blood gases, liver function test. You have to have check of blood culture to decide the kind of antibiotics. Okay, blood culture, especially in case of pyrexia, basically, sorry, pyrexia fever, if it is, and then you know, like as per the symptoms we have to include this kind of metabolic screen. Okay, apart from that, electrolytes are very very important, especially if you ask me, then I'll tell serum, sodium, potassium, calcium, and phosphate, phosphate, yeah. So these things are very very important. If there is a case of respiratory insufficiency, you understand how important to check the blood gases. Okay. Yeah, other things like vitamin B12 also to be tested. You have to check serum amylase. Okay. uh, Cortisol. Okay. Thyroid antibodies. Okay, so by this time you will come to know like what is the condition which is giving. So after CT scan, if there is a problem from the metabolic origin, you have to answer that we have to go for the metabolic screen. Lactate, one of the enzyme. Okay, it has to be checked. So as I told you, MRI is of less use. Usually CT is the preferable stuff. We do that. Okay, so in addition, okay, in addition, what all things we do in addition? This was one confirmatory, like it's urgent case, so we took that, we learnt about it. In addition, obviously, in addition, we will be writing skull x-ray. We can't write x-ray in general. Okay, skull x-ray. And we will be taking chest x-ray. So x-ray always is one of the important thing. Then we'll be checking EEG. You will be taking ECG only when there is a cardiac involvement. That anyway we have to do. As I told you, MRI also in addition, but of very limited scope. Very limited scope. Okay, especially as I told you earlier also, small ischemic focal damage. If we want to small ischemic changes, especially encephalitis. Okay, so small ischemic changes, basically we have to find out. Yes, especially in the infection like encephalitis. But again, encephalitis, more of I'll tell that early phase it is good enough to take MRI. Later again it is of less scope. X-ray, well, X-ray means what all things we have to check? Skull X-ray, tell me. We have to check any kind of fracture to skull bone, yeah, or any kind of, you can find out pineal shifting also in that pineal shift, or any sort of calcification, right? Calcification, or you can find out the osteolytic lesion. Okay, chest x-ray. Chest x-ray, obviously it may reveal, suppose there is a bronchial carcinoma. Okay, so it may reveal like bronchial carcinoma. I just gave you one example. Bronchial carcinoma, it may reveal the picture, so that we can think that yeah, it has like it has gone that way. It may reveal, anyway I'll delete it. So bronchial carcinoma is just an example, you can take it. Okay, it is one of the thing can be found out through the chest x-ray. Okay, EEG, obviously EEG has to be taken, especially in case of epilepsy. Okay, when it is non-epileptic case, or any kind of metabolic encephalopathy. Cool. Encephalitis, yeah. No, I didn't. When it is infection, we have to check more of blood, this ones. Okay, fine. Yeah, so this was the thing, like I wanted to teach you. I wanted to tell you about the COMA and basically the impaired conscious level. So we started with COMA, okay, what it is, and general pathophysiology. Then we saw about little detailed pathophysiology, right? So depending upon the parts involved. Then we saw about the causes, possible causes, intracranial and extracranial, basically, and this gives us a very good information about how we can actually classify, so that we can understand in deeper detail. Then we saw about the you know after causes we saw the diagnostic approach, which is very very important, which is the we took history, and very detailed history. Then we went for our general examination, okay, and that too in the very detail. We found out everything, and then we tried to learn properly about the neurological examination, which is the most taken one, and it works for you, so that you can check these many things we saw. Yes. And after that we learned about investigations, which is the most important investigation, as I told you, CT scan. And if it is a metabolic origin, we understand, then obviously this is the most important thing, like blood screening and other things, okay. And in addition, what all things required in investigation, that also we learned about it, okay. So this was for today, okay, and I hope I made it quite clear, and it is and all of you have understood these videos. My content will be uploaded on the channel very soon, and you all can take benefit of this by revising. If you don't understand, listen there again and again, and always in the doubt session, always in the session when I call you, I mean usually weekly once or monthly twice, so that time you can understand all those things, okay. So anything you want to learn, you can always message or you can mail. People in the team will answer you. So it was for today. Namaste, bye, thank you, thanks for joining.